Good morning, everyone. Thank you for joining us for September's edition of Health Bites with Region 3. We are so pleased to welcome this month's speaker, Dr. Kensley Behel. Dr. Behel earned her PhD in Performing Arts Health from the University of North Texas. She also works as a freelance journalist covering gymnastics all around the globe. She uses her combined experience in athletics and research to help musicians develop a health-aware mindset. In today's Health Bites, our speaker will give a presentation on musicians' hearing health. Thank you for being our guest speaker this morning, Dr. Behel, and I will turn everything over to you.
Thank you so much for having me. I'm going to go ahead and share my screen. Okay, can everyone see the screen okay?
Looks great.
Awesome. Today's presentation has been brought to you by the National Network of Libraries of Medicine, but the content is my responsibility and doesn't necessarily represent the views of the National Institute of Health. Another quick bit of business. I want to add a quick disclaimer that the text, graphics, and information contained in this presentation are for informational purposes only. This presentation and the information herein does not and cannot be substituted for the expertise of a medical professional. Please see a medical professional if you believe you're experiencing noise-induced hearing loss or tinnitus. The aims of today's presentation are to understand what noise-induced hearing loss is and the different standards created by Niosh and Osha. We're going to explore preventative measures and their positive and negative attributes. And I hope by the end of this presentation, you will be able to describe a decibel level and know how to measure them. So for those of you who are musicians, whether you're professional or you sing in a local community orchestra, or maybe just even with your church group, I want you to think back to when you first started playing or singing music. And as people from different nations and languages and traditions, we all have different reasons for starting music. Maybe some of our parents were professional musicians and we wanted to be just like them. Maybe some of us had to play the recorder in elementary school or join the school choir. Or maybe we just joined a musical group so that we had more community. But my guess is that part of the reason that you were introduced to music is because either you or someone you know believed in the benefits of music education, which have been shown to improve basic literacy and math skills and to reduce stress. Students who participate in music classes have been reported to have better verbal working memory and long-term memory. And while these things are wonderful and they are certainly true, it's not the whole truth. In addition to the many benefits of music instruction, there are also risks associated with practicing and performing music. Musicians are considered a population with a high prevalence rate of occupational injuries. And it's important to note that it's not only professional musicians that have a high rate of injury, but also young musicians. Musicians experience a number of health problems related to playing and performing music, but perhaps one of the most dire is hearing loss. And musicians have a 4 times higher risk for hearing loss than the general population, and are 57% more likely to have tinnitus or tinnitus, which is a ringing in the ear. And while the father of occupational medicine, Bernardino Ramazzini, may not have studied musicians' hearing health, he did notice that there were occupational hazards associated with the music profession. And in his treatise, he wrote, "It is so much better to prevent than to cure, and so much easier to foresee future harm and avoid it, rather than have to get rid of it after having fallen prey." And I would say of the 4 main areas of musicians' health, so there's musculoskeletal, hearing, vocal, and mental. I would say that this quote is most prominent for hearing health because, as we're about to learn, noise-induced hearing loss is irreversible and prevention is our only option. For the visual listeners here on the Zoom call, you can actually see an example of noise-induced hearing loss on the screen. The picture on the left represents normal and healthy hair cells in the ear, and on the right, you'll see the damaged cells. So let's go into what noise-induced hearing loss is. The National Institute of Health says this of noise-induced hearing loss: Every day, we experience sound in our environment, such as the sounds from television and radio, household appliances, and traffic. Normally, these sounds are at safe levels that they don't damage our hearing. But sounds can be harmful when they are too loud, even for a brief time, or when they are both loud and long-lasting. These sounds can damage sensitive structures in the inner ear and cause noise-induced hearing loss, otherwise known as NIHL. NIHL can be immediate, or it can take a long time to be noticeable. It can be temporary or permanent, and it can affect one or both ears. The seriousness of noise-induced hearing loss cannot be overstated. In fact, it is so important that the World Health Organization has said over 1 billion people aged 12 to 35 risk losing their hearing due to prolonged and excessive exposure to loud music and other recreational sounds. In general, noise-induced hearing loss can have devastating consequences for health, for education, and for employment. So to combat this, about half a century ago, the Occupational Safety and Health Act of 1970 established NIOSH, the National Institute for Occupational Safety and Health, as a research agency to focus on creating healthy workplaces. It also established OSHA, the Occupational Safety and Health Administration, to enforce the health and safety standards. OSHA's initial standards focused on asbestos in the workplace, but pretty quickly, hearing health and hearing conservation was added to their agenda. So a quick recap, NIOSH is for research and OSHA is for enforcement. And the way that they make recommendations for permissible levels for occupational hearing health is by using a measurement unit called decibel. Some people like to refer to decibel levels as how soft or how loud something is, but that's not actually correct. Softness and loudness are perceptions. Think about if you have someone in your life, specifically if they've experienced noise-induced hearing loss, they may have turned the television up as high as it will go, but they still perceive it as soft. So that's the perception of the loud and soft. A better way to characterize decibel levels is sound intensity. And this measurement unit is logarithmic. And that means that with every 3 decibel increase, the intensity of the sound doubles. And we'll get more into that on the next slide. We can also measure decibels and sound levels using decibel LEQ, or the average sound intensity over a particular length of time. The National Institute of Health has written about the sound that we're exposed to in our daily life. And to be totally honest, I had not realized how much sound I'm exposed to until a few weeks ago. My husband and I were on a trip to Switzerland, and we stayed in a small little village town called Mürren. And Mürren is one of the village towns in Switzerland where cars are not allowed. But there are a very few of the, I guess you would call them seasonal workers, that have access to golf carts. And in comparison to the quiet of the mountains, those golf carts sounded like racing cars. And it really made me evaluate how much noise I interact with on a daily basis. So for those of you who are currently in the Zoom session, when you look at the scale that I've put here on the screen, this artist used so many common examples, and you can see how much noise we're exposed to on a daily basis. So a refrigerator, the hum of a refrigerator, is around 40 decibels, a conversation around 60, a hairdryer 90, a police siren is around 120 decibels, fireworks about 140, a jet engine is 130, and I want you to keep that number in your mind for later in the presentation. And then, of course, for the musicians, a trombone comes in at around 110 decibels. So NIOSH and OSHA, they use these decibel levels to create different standards for what a worker can be exposed to on a daily basis. A quick reminder that NIOSH is the research body and that OSHA is the enforcement body. So NIOSH recommends that a worker be exposed to no more than an 8-hour time-weighted average of 85 decibels. And in the previous slide, I talked about the logarithmic value of the decibel. And so for NIOSH, that's 3 decibels, and which is the doubling of the sound energy. So if you look at the table, 85 is the max recommended exposure level over 8 hours. So you add 3 decibels to that and you get 88. But then you'll look and that time gets cut in half to 4. And you can keep going down. So if you add 3 to 88, you get 91. Well, the time then recommended is 2 hours at 91 decibel levels, and then so on and so forth. And then you have OSHA, and OSHA has a permissible exposure limit. And this is the legal limit set by OSHA. And their standard is 90 dB over an 8-hour workday. And so if you go back to the slide just for some reference, 90 dB is about that of a hairdryer. So let's look at how all of these standards apply to music. In 2011, Niosh evaluated the noise exposure of a band director in Alabama. This band director had submitted a complaint because they were concerned about hearing loss from exposure to loud noise. Niosh took measurements over the course of 2 days and various musical activities, and they found that the band director exceeded the Niosh recommended exposure level. They also found that that exposure reached 110 dBA, which was about that of the trombone if you look at the scale. And the highest noise exposure occurred at 125 hertz. And we'll come back to that number later. Ultimately, the researchers concluded that there was not one single approach that could fix this situation because the room that the music was being produced in was not designed for musical performance. They suggested a combination of increasing the distance from the band director from the ensemble, installing different absorbent material, and asking students to play more quietly. And ultimately, there were 6 recommendations that came out of the study. And throughout the rest of this lecture, we'll talk about which of them are still relevant and which ones are outdated. The short version of these 6 recommendations were hold marching rehearsals outside, which I think any of us who have been exposed to marching band can very much understand why you would want to hold a marching rehearsal outside. Stand away from high reflective surfaces like whiteboards. Move the students further away from the band director. Provide the band director with musician, quote unquote, musician earplugs. 5, establish a hearing conservation program. And 6, share prevention methods with students and parents. So the same year that study was conducted, the National Association for Schools of Music, which is the accrediting body for about 600 plus schools of music in the United States, expanded their accreditation standards to educate students, faculty, and staff on the basics of musicians' health, which included hearing health. And the standard reads, students enrolled in music unit programs and faculty and staff with employment status in the music unit must be provided basic information about the maintenance of health and safety within the context of practice, performance, teaching, and listening. For music majors and faculty and staff, general topics include but are not limited to basic information regarding the maintenance of hearing, vocal, and musculoskeletal, and injury prevention. And since this time, we've seen a large increase in the amount of studies on musicians' hearing health, and these studies utilize the Niosh and or OSHA criterion for measuring daily dose. For example, a 2016 study at a college in the southeastern United States found that 49% of participants exceeded 100% of their daily dose on one day, and that 19% exceeded their daily dose on both days. A 2019 study found that over half of woodwind and brass players exceeded Niosh's recommended exposure limit. So between the Niosh study that we first learned about a few slides ago and then these 2 subsequent studies, there is definitely cause for concern, but there's also a different problem. And that is that the standards used in these studies were designed for factory noise that is more or less constant. And music is not factory noise. Niosh agreed. In 2015, Niosh released this statement. The Niosh recommended exposure limit was developed to assess the risk of hearing loss among industrial workers exposed to steady broadband noise over 8-hour work shifts for up to a 40-year working lifetime, and thus not be completely applicable to assessing the risk to musicians and other music professionals who have irregular and unpredictable sound exposures. Musicians' work schedules vary considerably. They typically play less than 4 hours per day and sometimes just 2 or 3 sessions or work shifts per week. So let's look at why these standards may not be appropriate for musicians. As I alluded to earlier, not all noise is equal. And to that point, there is some movement in the community to rebrand noise-induced hearing loss to music-induced hearing loss. And I think the reason why will become apparent in a moment. But before we get into the effect differences between industrial noise, for which the Niosh standards were made, and music, I want to introduce you to a term called temporary threshold shift. And the temporary threshold shift, or TTS, is a type of temporary hearing loss that happens after exposure to high decibel levels. And this can happen after very common events like flying on an airplane, going to a rock concert, or even attending a college football game. So several years ago, researchers began looking at different types of noise and how they affect temporary threshold shifts. And the first study took 10 participants and exposed them to pop music on 5 different occasions. And then on 5 other occasions, they exposed them to noise, which had the frequency and time distribution characteristics of the pop music. So they were essentially equal in energy. Now, 4 of these participants had equal temporary threshold shifts, but 6, so the majority, had longer recovery post-exposure to the non-music stimuli. It's very interesting. A German team completed a similar study looking at industrial noise, classical music, and heavy metal music. And listening to metal music had a similar temporary threshold shift to exposure to industrial noise. However, classical music caused threshold shifts that were about a quarter of the magnitude of those after exposure to industrial noise or heavy metal music, meaning the majority of participants had a quicker recovery after exposure to classical music than to metal music or factory noise. So then the question becomes, if we know that musicians are 4 times more likely to experience noise-induced hearing loss than the standard public, and they are also at a high risk for tinnitus, but the existing standards for occupational health aren't applicable to musicians. And even if they were, we have solid research demonstrating that the effect of different types of noise or music produces different level of damage. Where do we go next? Some of you may be thinking earplugs, and that's exactly where a lot of other researchers and educators went too. If you look up hearing protection standards, you'll find that the occupational noise exposure standard requires that the employer provide hearing protectors to all general industry employees exposed to an 8-hour time-weighted average of 85 decibels at no cost to the employee. And you'll also find that the research says that these earplugs are very effective when used properly. But as I've hopefully already convinced you, and hopefully you're already saying to yourself, music isn't factory noise, and you'd be correct. So just as the Niosh standard said that their recommendations for exposure to noise aren't necessarily appropriate for musicians, I would argue that similarly, the testing protocol for the efficacy of musicians' earplugs isn't either. So the testing for earplug efficacy is called the Real Ear Attenuation at Threshold, or REAT testing protocol. And it was designed to test earplugs for factory settings in a laboratory, and it tests frequencies from 125 hertz up to 8,000 hertz. This testing protocol also has known limitations for testing with earplugs below 500 hertz. So to give you an idea and some actual relevance to those pitches, an oboe tunes the orchestra at A440, and that means the A is 440 hertz and is represented by a blue dot here on the screen. The REAT testing protocol, which is known to have limitations when testing below 500 hertz, would include this pitch, which is the main tuning pitch for the orchestra. But what is really interesting is if you are looking at the screen right now, you can see an arrow in white. And the REAT testing protocol doesn't test those frequencies at all. And it's not just the REAT testing protocol that doesn't test that low either. I recently got certified as a hearing conservationist. And even in this high-level training, I was speaking with audiologists who work with musicians on a daily basis. And they communicated that they aren't testing below 500 hertz, which ignores a large portion of frequencies that musicians encounter on a daily basis. In fact, if you'll remember in the 2011 Niosh study for the band director in Alabama, Niosh found that the highest noise level occurred at 125 hertz. And that's about where this white arrow begins. So to put all of this in perspective, my wonderful colleague, Megan Taylor, came up with this great analogy that I have to share. And she said that using the RIAT protocol for testing the efficacy of earplugs for musicians is equivalent to a piano tuner coming and testing 7 notes and then leaving and claiming the piano is in tune. And using a standard testing protocol for factory settings, this makes a lot of sense because factory noise is more or less constant. But music it's vibrant and it's filled with more frequencies and dynamics and color. And we need more accepted testing protocols that acknowledge this fact. Recommendations at the highest levels still continue to maintain that musicians' earplugs are an effective way to mitigate hearing loss for musicians. But what happens when they recommend the quote unquote musicians' earplugs that have passed a protocol that doesn't even examine frequencies that musicians hear daily? They recommend something that may actually have a damaging effect. And to that point, a 2014 study found that musicians' earplugs didn't work as they claimed. Not only did they not lower the decibel levels equally, they actually increased decibel levels at low frequencies. I'll say that again. These earplugs actually increase decibel levels or sound intensity at low frequency levels. Other studies on different types of earplugs have found that while they don't necessarily attenuate or lessen decibel levels equally, musicians don't care for them because they can be uncomfortable. Some of them are unaffordable. Some of them make it hard to communicate in rehearsal, and overall, they can change the sonority of the instrument. I want to be clear, it's not that all earplugs are bad. They aren't. And it's not that there aren't purposes for earplugs. There most certainly are. But what I want to say and what I want to communicate is that research confirms that earplugs are not the one-size-fits-all solution for musicians that public health officials, educators, and musicians might assume that they are. So where does that leave us? Is there any hope for musicians and their ability to prevent noise-induced hearing loss? And I would say yes. Remember the quote from the beginning of the presentation from Mira Mazzini about prevention? That's my number one tip for musicians' hearing health: prevention. Because noise-induced hearing loss is both preventable and irreversible, it's important to internalize this quote from Mira Mazzini that prevention is key. Anecdotally, I've heard from so many of my peers that they don't believe that noise-induced hearing loss can happen to them. And statistics from the CDC and the World Health Organization certainly back up these anecdotal experiences. So I want to put the commonality of noise-induced hearing loss into perspective. According to the American Academy of Audiology, 1 in 3 Americans develops hearing loss as a result of exposure to noise. So that's 33%. To put that in perspective, 25% of Americans need a root canal, 24% of adults get arthritis, 19% have an anxiety disorder, and 3% of Americans have a heart attack. So let's look at some effective ways to monitor and prevent hearing loss. One of the best ways to track your hearing health is to go see an audiologist. An audiologist can confirm through an audiogram, which is a test that demonstrates your ability to hear certain frequencies. And having a baseline audiogram will allow you data to your own health to figure out how your body is responding to noise. The first time you go to get an audiogram, you should be free of loud noises for at least 14 hours beforehand. Otherwise, your baseline audiogram would be skewed. So make sure you don't schedule a test after traveling on a plane or attending a loud concert. A lot of musicians struggle to know which medical provider to see when you're first going in for your hearing testing. So whether it's for a baseline audiogram or because you are expecting that you have a problem because you're having symptoms of noise-induced hearing loss, you will probably see an audiologist because an audiologist primarily deals with hearing loss. Now, there can be many different reasons for hearing loss. And so if the audiologist suspects that hearing loss is due to trauma or disease, such as a tumor, they may refer you to an otolaryngologist or an ENT who could provide various other treatments. Both audiologists and otolaryngologists can perform earwax removal or cotton tips from a Q-tip removal. And if no one has ever told you this, do not stick a Q-tip into your ear. You could damage your eardrum or push enough cotton down into your ear canal to create a form of temporary hearing loss. And this leads me to the subject of hygiene. So sometime around middle school, we start to learn about hygiene, that deodorant is a good thing, that showering daily means we are less likely to smell bad, that brushing and flossing our teeth is important for tooth health, and also it makes sure that our friends don't need to stand 10 feet away from us. Many musicians even learn about instrument hygiene, things like swabbing out our instruments, cleaning mouthpieces, and changing reeds often. But rarely do we learn the full scope about what hearing hygiene is before it is too late. And I describe hearing health hygiene as the daily regimen to keep your ears healthy. So in other words, it's the support of a healthy and strong cochlea throughout your life. So ways that you can do that, just like you schedule an annual checkup with your family medicine doctor and go to the dentist twice a year, a visit to the audiologist should be included in that list of yearly visits. You can monitor your daily dose to some extent. So many smartphones now have the ability to give you some insights into your daily noise exposure. If you're at a large university, you may have access to professional grade dosimeters, which is a way you can measure decibels to monitor decibel levels in your classroom. And then finally, if you are going to a concert later in the evening, or if you know that you're going to have many rehearsals for one day, you can give your ear a break. So similar to how an athlete might do some gentle stretching or meditation before a big game and not a full-fledged workout, we should also give our ears some downtime and not expose the cochlea and the inner hair cells to high decibel noise all day. So these are some things that you can do personally, but hearing health, especially in the context of making music, really is a team effort. So we've talked about the role of the musician, the role of the medical provider, but what about the ensemble director? One of the most encouraging studies for musicians' hearing health was completed on jazz bands in Texas. And a research team set up a series of ambient information systems into the jazz room that provided real-time decibel readings for the instructor. The room and the dosimeters, they stayed constant, but the musicians and the director changed. And over 9 weeks, there was a significant decrease in the decibel levels among the majority of the ensembles. And this brings in the public health concept of the music director being a risk regulator, and that with training and live feedback, they can have a positive influence on the health of their hearing and the hearing of the musicians under their direction. Ensemble directors, whether band, choir, or orchestra, should be aware that the style and conducting movements have an ability to increase or lower decibel levels in their classroom, and thus should consider self-evaluation and live feedback in their classroom. In addition to having live feedback, music educators should consider programming as a way to limit exposure decibel levels. For example, you might not want to program 1812 Overture and the Tchaikovsky Canon, and Asphalt Cocktail and the Banging Trash Cans, and Holst the Planets on the same concert. Mixing stylistic options, including ballads, hymns, and other styles that typically produce less decibel levels, may be a good way to manage risk of noise-induced hearing loss in the classroom. And that brings us to one of the most interesting developments in musicians' hearing health to date. And that is looking at the role of administrators and artistic directors in relation to musicians' hearing health. In 2018, there was a landmark decision in England where a well-known professional opera orchestra was found liable for one musician's hearing health after exposure to acoustic shock. The musician argued that in the rehearsal of Wagner's Die Walküre, he was exposed to decibel levels of over 130. And if you think all the way back to the beginning of the presentation, 130 decibels is roughly the sound intensity of a jet engine. According to the BBC, the Opera House argued in court that, quote, a balance had to be struck between preserving the artistic integrity of the music while doing everything possible to reduce the risk of damage to musicians' hearing, that they felt was an inevitable feature of playing long-term in an orchestra. The judge disagreed and said, the reliance upon artistic value implies that statutory health and safety requirements must cede to the needs and wishes of the artistic output of the opera company, its managers, and conductors. Such a stance is unacceptable. Musicians are entitled to the protection of the law, as is any other worker. That is profound, and it will likely have implications for how we move forward. So to sum up musicians' hearing health and to look for the future, I would like to see a comprehensive hearing conservation program designed specifically for musicians, which in my opinion requires a team effort. And I want to once more look at the example of professional sports. So a coach may set the direction for the team, a nutritionist may make sure the team is fueled properly, a physical therapist may help prevent and address injuries, and then the athlete themselves needs to put in the work to communicate what is happening with their health and to follow the plan laid out for them. But if the plan laid out for them and the people in charge of them are uninformed, it could lead to consequences. And that's really sort of where we are now with musicians' hearing health. So let's review and recap what are each of the team members' roles. So for the educator, I would argue that they need to understand their role as a risk regulator, that their conducting and direction has the ability to control dynamics and decibel levels in the rehearsal and performance. They also need to understand how programming can affect decibel levels in the classroom and performance and consider a varied program. Policymakers and medical providers at the highest levels are often still uninformed regarding the intricacies pertaining to musicians' health and use Niosh standards, which Niosh has explicitly stated may not be appropriate for musicians. So I implore those in these areas to consider and implement occupational standards appropriate for the music profession. That means coming up with innovative solutions and using the full spectrum of frequencies that musicians are exposed to on a daily basis and not just a few. And then the musicians themselves have a responsibility to get yearly audiograms and monitor their daily intake of noise. And I want everyone to sort of be aware that even though the current standards for exposure to decibel levels don't apply to musicians, the OSHA still requires that you have access to hearing protection if you so want it, and that it comes at the cost of the employer. I hope you enjoyed this presentation on musicians' hearing health. I believe we have time for a few questions.
Feel free to type those questions into the chat, folks. And while we're waiting, I do have a question, Dr. Behel, that sort of I've been thinking about the whole time. We talk about, like, you know, how loud things are. I know that you said that wasn't a great representation, but you know, when we talk about like the decibel level for a jet engine versus a trombone, what distance are we talking about? Just so I can like better wrap my mind around how loud things are. It's a jet engine from how far away, or a trombone from how far away from the listener?
In terms of how to make it safe, or in terms of where these measurements are taking place?
Where the measurements are taking place.
I believe they're quite close. I don't know the exact distance, but I can look that up and get back to you. Let's see. Questions. Let's see. One person said, as a choral singer, I have wondered about this when I've gone for audiology testing. I never knew about the 14 hours of no loud noises or sound before having to have an audiogram. So this was one of the things that was hammered in when I got certified to be a hearing conservationist, that if you don't wait 14 hours without exposure to loud noise, that basically your audiogram is considered invalid. And that doesn't mean that you can't have any exposure to noise. It's not like you have to go lock yourself in a classroom for 14 hours beforehand, but not putting in your earbuds and turning up music maybe that you would listen to, or maybe you would want to get it done on a Monday morning. So especially if you're a choir director, so you don't have exposure in the classroom the day before. One person said, what do you recommend parents do for school-aged kids in band or orchestra? That's a great question. So parents, of course, are certainly part of the equation, especially if the musician is under 18. So I would encourage you to have your child get a baseline audiogram. I think having conversations with your band director or orchestra director, just to let them know. Unfortunately, a lot of this information is stuck behind like what I call academic jargon, or, these different paywalls, and is really inaccessible to most musicians. And just letting them know what's going on so they can consider programming or consider how their movements in the classroom are affecting hearing loss would be important. Okay. Let's see. The difference between a frequency, a hertz, and a decibel. Okay. So a decibel level is the measure of sound intensity, and a hertz is a frequency that produces a different pitch level. So if you have noise-induced hearing loss, you typically start to lose your hearing at higher frequencies. So that's around 4,000 hertz. And you may start to lose sounds like S's and F's, which are at higher pitch frequencies, and that can make communication so much more difficult. So decibel is how we measure the sound intensity, and then hertz would be the frequency that sound or pitch is at. Are there any special earplugs that may be useful for musicians to consider? Okay, so this is a really tough question that unfortunately there is not a complete answer for. So as the study from out of Germany suggested, that metal music had very similar temporary threshold shifts to that of frequency noise. So what I would say that indicates is if you're going to a heavy metal concert, you would probably be fine using a regular industrial grade earplug as long as it is inserted correctly. We do know that a lot of the earplugs that have been studied have more efficacy in the higher pitched frequencies. So if you are playing an instrument with higher pitched frequencies, earplugs may be more effective than if you're playing an instrument with lower frequencies. But again, unfortunately, these earplugs are being tested using a protocol that doesn't examine the spectrum of the frequencies that musicians are exposed to on a daily basis. So I am extremely hesitant to give any sort of recommendation specifically for musicians' earplugs or earplugs in that type of setting until we have more research. Another person asked, is hearing conservation something that music schools, colleges, and universities are taking part of health equity? No, unfortunately. So there's a couple different parts to this to answer this question. So there are the standards that are available for the accredited schools by the National Association of Schools of Music. So they are all required to provide instruction on these areas. And you have some universities that are doing a pretty good job. And then you have some universities that are posting a PDF and they're still getting the same sort of check mark from the accreditation body. And then in Texas, it is the only state, to my knowledge, that has health standards like this for the secondary and tertiary level. And again, it's just that standards were sort of created without a training protocol. And teachers are often unaware about the best way to implement these standards in their classroom. One person said, a little off topic as it pertains to frequent concert going as opposed to music playing. Does this mean that my edemotic earplugs are not offering me protection? I'm certainly more comfortable when I wear them and afterwards as well. Okay. I would recommend going and looking at the study by Chesky and Amlani. I believe it was published in 2014, and that looks at the use of all of the different, or not all, but many of the different edemotic earplugs, and you can see which of the different ones sort of protect you where, and that can give you more guided information about which earplugs to use and which ones may be best for you. Okay. You mentioned that the Niosh rating system for safe earplugs was designed for factory workers, not musicians. Are there any earplug makers doing this research? Are there any plans for Niosh to add musician hearing info to improve efficacy of hearing protection? The same study that I mentioned earlier, the one by Chesky and Amlani, looked at, I think it was over 2,000 frequencies. You'll have to double check me on that. But that is the only study I've seen in recent years that looks at multiple different frequencies, but they were just some researchers from a university. They weren't actually earplug makers. I am not personally aware of earplug makers that are currently testing the wide range of frequencies that musicians are exposed to on a daily basis. I am also not aware of any plans for Niosh to add musicians hearing info to improve the efficacy of hearing protection either. I would love and honestly expect that Niosh and Osha should create better hearing protocols, because I think the study from BBC, the article from the musician in the opera orchestra in London, it summed it up best, that musicians are like, we deserve the same protection under our version as OSHA that every other worker is exposed to and has access to. So I hope that they will come up with something soon. Okay. Someone said, not directly related to music, but would it be good practice to have our workplaces, quote unquote, libraries, tested for noise levels? We had a part of the library that no one ever used, and we finally figured out that there was a loud whine in some of the AC equipment that none of us older staff members could hear. And we got it fixed and that space used again. I would say that any workplace should have its decibel levels tested, and tested over time, because noise is rarely static, especially in a live working place like a library, right? The noise that people are exposed to in factory is really more or less constant. But in a library, you have people coming in and out. Maybe you're hosting, a children's series in the morning and you're reading books to them and they're really squealy and excited. And so the decibel levels are going to be different. So maybe, you can utilize a larger space in that scenario. So I would say yes. Let's see. How do you know when an earplug is inserted correctly? Okay. I unfortunately don't have my camera on for demonstration, but you want to, this is specifically for the foam earplugs. So you want to roll them up as tightly as possible. And then you pull up the back of your ear. This is really hard to explain without showing you, but you sort of reach one hand around to the back of your other ear. So if I'm pulling my left arm around the back of my head to pull up my right ear. In my right hand, I would have rolled the foam earplug into a tiny ball and then inserted it and then allowed it to fill up space. So I hope that makes sense. Let's see. What is the best equipment that I can buy for a family member to use when watching or listening to TV because they have it too loud for me? So this is just anecdotal. My grandfather really suffered from noise-induced hearing loss, and we bought him a set of, it was a big set of headphones that he was able to sort of track like the decibel levels, and then he was able to turn up his volume separately from ours so that we weren't exposed to the high energy decibel levels. Okay, let's see. What is the name of the device used for the band directors to monitor the decibel levels during rehearsal? Okay, it's called a dosimeter. And then the same person asked, where should it be placed in the room? So this is a really interesting question. So when there were studies done on the jazz bands in Texas, they had many, many different dosimeters in the room. And they found that lead players in a jazz band experienced more exposure to decibel levels than maybe another player. So because different people in the ensemble have different exposure levels. So for example, if you're in an orchestra and you're in the front row of woodwinds, like right behind the brass section, you may have more exposure to decibel levels than, let's say, you know, a violinist in the back of the section. So ideally, you would have multiple dosimeters set up around the room so that exposure can be monitored throughout.
Dr. Behel, there was one question a little higher up, and it is, don't young adult females usually hear higher pitches than similar men cannot hear?
That was something that was talked about in our the certification training. I don't have a study offhand that I can quote, but that was something that was talked about in the certification training from KAOC that I did about 2 months ago. So yes.
We would like to thank everyone for joining us today, and of course, extend a special thanks to Dr. Kensley Behel for sharing your expertise with us. We look forward to seeing you all at next month's Health Bites with Region 3.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.